good morning. It's Dr. Buford. I'm here with Mitzi and the rest of the shoulder team. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen, and you're laying on your side, so the arm is up in the air. The socket part of the shoulder is down at the bottom part of the screen there. So as we look over here, we can first look at the biceps. We can see some tearing in the biceps tendon there. So we're going to go ahead and secure that in just a second here by passing a stitch through it. There we are, going through part of it there. Now, through that needle, we're going to pass a black wire called the super shuttle. And then we're going to grab that and use this shuttle to relay a stitch back through the biceps. So that's the first step. Second step, we're going to pass that needle through one more time, slightly different area. Take that right there. Pass that wire through again. Now we're going to reach behind the biceps to retrieve the relay. Now you can see we have a good hold on that biceps tendon with that stitch. So now we're going to go ahead and take a pair of scissors and cut the biceps at its base, right down here. And now we'll put in our shaver and try and clean up some of the areas in the joint that may have some arthritis, and we'll also get a look at the rotator cuff. How's our friend doing? Pause please for a second. Okay, so we're up above the rotator cuff in a part of the shoulder called the subacromial space. And what we're doing here is taking off a little bit of the anterior acromion. Let me get it positioned here so you can see. So this is a bone that makes up the roof of the shoulder. And you can see how this bone comes really close to the rotator cuff. There's the tear right there. And so we're going to go ahead and start the burr and just remove this little lip of bone that has the potential to dig into the rotator cuff and even affect the repair. So by removing this, we're going to make a lot more space for the flow. Okay, so there's the bone now. And we've got that where it's nice and smooth and flat. And hopefully shouldn't present a problem to the rotator cuff once we fix the rotator cuff. Pause, please. So this is the tear in the tendon. Just been working to clean up the edges and identify the bone so we can get this repaired down. As we lift up here and look to the left, which is posterior, we can see the tear extending down this way. Up, we can see how it extends back there. So what we're going to do now is take a spinal needle and that looks like a pretty good spot to place an anchor. Don't know if it's going to be two anchors yet or not. Looks like maybe one side to side and done, you can see how this kind of has a V shape going back here. There's the apex of the lower lead right there. So we're going to make a little nick in the skin. I have a free suture. I'm going to put it one side to side. And then we're going to place our guide for our anchor. So there's the guide for our anchor. We're going to place this right where we're level at. There's our picture. And we're going to place this right about here. Now this is a special anchor. It's an all suture anchor. It's got 3 separate sutures inside, so it's what we call triple loaded. Now we're going to seat the anchor by pulling back on the sutures. Make sure that's solid. We had a little cyst there in the bone, so we put a metal anchor in deeper through the cyst, and we have good fixation. You can just see the top of the anchor there, so it's actually not that deep. But that's what we had to do to get solid fixation. It's still triple loaded, and so now we're going to take the black and white striped suture on the left out the anterior cannula here. We also did our side-to-side stitch already. You can just see the blue and white suture there. So we've got a side-to-side kind of ripstop stitch. And in just a minute, we'll show you how we pass our next stitch. Pause, please. Okay, so we've got our first stitch all the way underneath the rotator cuff. And as we pull back, you'll see that black and white suture right there. And it's going to, hold the camera there, please. It's going to come out right through the cannula there. That's just exactly what we want it to do. And next we'll reach in and get the partner black and white suture right here. Okay. Now we're going to take the next suture in line out the front, which looks like it's going to be the blue and white suture here. We'll make sure we don't unload the anchor. And now we'll take a turn to the right suture hook. There it is right there. Idea of how we pass our second stitch behind that ripstop suture. And we'll retrieve it here, show you some more in just a minute. Pause, please. Okay, so what we're doing here is taking all the sutures out the anterior cannula like that, so that we can now tie them one at a time from posterior. And as you recall, the black and white suture was the first one that we worked with, so we'll grab that first. Just like that. And we'll go ahead and start tying these sutures one at a time. We'll show you this first one here. here's the repaired tear. That looks really good. You can see our ripstop stitch and how we're behind it right here. Okay, so I'm happy with the way that looks. And the last thing we have to do is tie the sutures for the biceps. So we'll get that done and show you some more just a minute. Okay, so we've got the sutures tied for the biceps. That's that white stitch right there. And everything moves together as a unit. We've got our rotator cuff repaired. We've got our biceps tacked down. So we're going to finish up and get you back to the recovery room shortly. Good luck to you now. Bye-bye.